Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to be going over the typical mistakes that people make with push-ups that lead to neck, lower back, and of course shoulder pain. So the typical mistakes that cause pain and injury during a push-up can be divided into three regions: the lower back, the neck, and the shoulder. Shoulder posture must be addressed first by making sure that your shoulder blade and your upper arm are in their proper position. Now, many times a winged or a rounded shoulder blade or a tipped scapula or shoulder blade can produce a lot of pain because there's an abnormal mechanical stress on the rotator cuff and the structures around the shoulder. If you're not sure about your shoulder posture, I invite you to go to the Pain Free and Fit website and take the free body analysis there and learn about your shoulder posture, both in terms of your shoulder blade and your upper arm. Typically during push-ups, the upper arm can either move anteriorly or forward in the socket, or upwards in the socket, or actually inwardly rotate. And that's a very common source of repetitive pain and injury from people doing push-ups. So once we get our shoulder posture set, both aligned so that our shoulder blade is aligned so we're flat in the front of our shoulder, and our upper arm is centered in the socket, meaning that if you have a forward or anterior upper arm out position or superior, you've brought it back into position. We're going to protect our shoulder by taking a rotator cuff tension that draws our upper arm back and into the socket. That's at about a 30-degree angle from sideways. If that's 90 degrees and that's 0, 30 is going to be right here. I'm going to pull my arm into the socket. So I use that pull-in maneuver. That initiates rotator cuff tension and protects my shoulder from damage. Then I'm going to get into the push-up position. I'm going to make sure I keep my tailbone slightly tucked under to prevent arching my back. I'm going to make sure my head is not goosing forward but back. And I'm going to make sure both shoulder blades are slightly pinched together and flat against my rib cage. Many people at the top of the push-up position will hang in that position, and that puts a lot of stress on the shoulder. Okay? You're allowing your rib cage to move forward from your shoulder blades. So you want to make sure your shoulder blades are flat against the rib cage and pulled back. Shoulder or scapular alignment is in position, avoiding any of your unique problems that you've identified, and your upper arm is centered in the socket and pulled back into its proper alignment. As we breathe in and descend, if our elbows move out, that's going to be a lot more stressful on the shoulder. So for those of you who have shoulder pains, let's try to keep the elbows moving at a 45 or 30 or even less of an angle closer to the side. As I come down, I'm maintaining the shoulder blade and the upper arm position and then pushing back. The biggest problem is when I get to the bottom, my upper arm is going to want to move forward in the socket. So if I have an anterior mount position of the arm, I want to keep that upper arm back in the socket and any shoulder blade correction engaged as well. The second problem with push-ups is the neck pain that's aggravated. And that's typically from allowing the head to goose forward, especially towards the bottom of the push-up, or allowing the shoulders to start shrugging up. So again, in that position, we want to emphasize shoulder blade depression towards the hips and pulling the face towards the back of the head. That's head retraction as I'm going through the push-up, but especially at the bottom, avoiding that and that. Keep blades down, head back. That's going to protect our neck, as well as making sure any tendency to laterally tilt or rotate the head is held in position. Again, if you go to that body analysis on Pain Free and Fit website, you'll see if you have a tendency to tilt or rotate. You want to hold that in a position, shoulder blades down, head back. That protects the neck. And the last position that we want to address is the position of the lower back, because a lot of times any type of extension, which is a backward bending of the lower spine, will aggravate lower back pain during a push-up. So once we're in position, that tail under and a slight crunch down keeps the back firm, meaning it's avoiding an arching as I descend especially at the bottom, and come up. This is especially common when we are doing a lot of reps and we're getting fatigued. The more we get fatigued, the more that low back wants to sag. We've got to hold that tail under, crunch down throughout the range of motion of the push-up. We also want to avoid any side tilting of the hips, meaning the hip is hip hiking up into the rib, or any rotation of the torso or of the pelvis. If there's a normal twist to your rib cage or your hips on your posture exam, and that's again something you can look at the Pain Free and Fit website in terms of our body analysis, we want to make sure that as we're coming up and down that push-up, we are having the correct alignment. Because again, especially towards the bottom of the push-up, that's when any type of rotational tendency is going to come out. So during your push-ups, we have the lower tummy in, tail under, and a crunch. Alignment issues addressed in the pelvis and the ribs, keeping the back stable. We have blades back so they're flat, arms sucked into their sockets with rotator cuff tension, head back, shoulders down, elbows closer to the sides to avoid shoulder irritation. We're breathing in as we descend, and we're exhaling as we come up. All the motion is happening in my shoulder and elbow. The rest of my body is square. Do your push-ups like that, and you'll prevent a lot of pain in the lower back, neck, and shoulder.